Hi, my name is Pooja and I'm working in the corporate hospital in Delhi. And I was the infertility patient of so many of hospitals, where would like to give you the background of all my complications and treatment that I have gone through. As you know that everybody prefers to go to the high-end hospitals and get the treatment. As I'm working in the hospital, so it was never a difficult task for me to get the treatment done. So I have been consulted in the very known hospital in Delhi. I will not name here. And I am 2.5 years being married, and in last 6 months I was trying to get to get pregnant, but I felt there's something wrong that I'm not being able to do it. So I decided to go and meet some doctors and get the treatment done. And after 3 months of my treatment in some hospitals, they have suggested me to go for the HSG test. In my HSG test, I came to know that both the tubes are blocked, and they have suggested me to go for the laparoscopy, and then also said that there's no 100% success rate of the laparoscopy. Later on, may possible I need to go for the IVF. It is very heart burning, like in such an early stage of your marriage and you're trying to conceive, and somebody told you that is very difficult for you to conceive, and that too, if you want to conceive, you have to go for so many technicality and there's no surety of success also. So fortunately that time my parents was in a town, and I shared all the reports and everything to them. I was very crying, I was very upset on those parts. So they suggested me, no, don't go for the surgery, look for some other options. We will also talk to so many doctors and we will find out a best solution for you. And while doing all these periods, everybody is trying to get the answer of all the questions and worries that we are having. So I was doing also so many Google research and so many videos on YouTube. What is tubal blockage? Because till the time you're not married, you're not trying to conceive, you even hardly know what is tube, what is ovaries, what is the tubal blockage, right? So getting all the research on all the problems, and then one of the patient has given the review after her success story, and fortunately her story was matching with my condition. She was also being asked by the doctors that you need to go for the laparoscopy and then IVF. So I decided to convince my husband, and we came here. When we came here, it was a small setup. Then I was thinking, like, how come in such a modern environment and the technology, how come Ayurveda can help us to get through all the complicated situations and all? But I was totally wrong. It being only 6 months that I've been treated. In just 3 months, both the tube was open under her treatment. There was such set of treatment and that the Dr. Chanchal provide. The best thing about this institution is, like, she heard you completely. What is your problem? And there's a treatment that's very patient focused. It is not a predefined treatment that giving to everybody, no matter what is the problem, and just gaining and earning the money. It's not like that. Every individual has a different problem. Even the 1% of deviation in your problem require a different 1% of treatment. So she has very focused treatment. She heard the patient completely. She understands the social, emotional and financial condition of the patient, and she has designed all the treatment. And in 3 months, both the tube was open. As I'm working from last 9 years, so you know that's in a busy schedule. You hardly being able to take care of your food, your diet, your lifestyle. Everything is a very contributing factor to your pregnancy and preparing your body for the pregnancy. So Dr. Chanchal has also helped me to balance all my hormone, help my body to be prepared to conceive. And after my tubal open all the treatment, in 2 months I am pregnant now. It's 1 month of pregnancy. I came to share my feedback with Dr. Chanchal. She has given me the further treatment, precautions and medications to sustain with the pregnancy and have a healthy and successful pregnancy in future. So why I'm sharing with you, because everybody have a perception that high-end technology, so much of money, so much modern environment will give the best service to us, but this is completely a wrong perception that we are having. I am very fortunate enough that I have taken the right decision, and in just 6 months, in the month of March, I have just started to try to conceive, and all the news was come up. In month of October, post 1 month, in November I am 1 month pregnant. So don't waste your time, your emotions. Is ultimately what we want: a healthy life and healthy pregnancy, and in a very most effective way. Ayurveda not only helps you to treat your current problems, it helps you to sustain with the healthy life also. There are so many things which has not been diagnosed in the even in the allopathy. In Ayurveda, when you get the treatment, it's completely work in all the area dimensions of your body required, and then you will end it with the best result always possible. Even I am working in the corporate hospital, getting any treatment by any qualified and highly paid doctor is an easy task for me. But what actually I got the one solution where if I would have chosen the way to go to laparoscopy and IVF, I'm wondering at where I would be landing. So not taking that decision, even though whenever I was doing some treatment, some test as per the requirement of my Ayurveda treatment, also like follicular monitoring was there, some ultrasound there, because doctors also need some reports to see. They were not even to give me the right report of the ultrasound. And on that basis of ultrasound, so many treatment was going on. I was not being able to understand that so many medications are there, so many things I am taking precaution on, but why the things are not happening. And then I decided to go to a very, very economical place to get the ultrasound done. And I got to know the hospital providing me the ultrasound report was not even correct enough to take decision on the behalf of doctors. So, this is completely wrong perception for anybody is thinking like you have a money, if you go to any big hospitals, you will be well treated. So don't waste anything on that, and come and meet Dr. Chanchan. You will find that, and you will be thankful for me your lifetime to getting these suggestions and believe in that. Thank you so much.